Trying to fix this thing here. Yeah, like that. So guys, how is everyone? How is the day for everyone? How is everyone doing today? Hope everyone is doing cool. And we thank God for the purpose of life and the hustle that we're going through and everything that we're going through. So today we are doing management of dilated cardiomyopathy. And dilated cardiomyopathy, we saw are heart muscles that are enlarged. Let me get to heart muscles that are enlarged, big heart muscles, you see. So we introduced it yesterday and we discussed some things. We discussed some 1, 2, 3 things, and we saw how dilated. These are cardiomyopathies. They are conditions of the heart. Some conditions of the heart. So conditions of the heart, apart from heart attack, we have the cardiomyopathy. So the first one we discussed was dilated. The heart ventricles are big, even pumping blood. You know, if heart muscles are big, even the ventricles valves will give us space. Will give us space, you see. So you know, when you have these conditions, and we categorize them, some people go to hospitals, they are treated. Welcome, I can see the people coming in. Welcome and tell me where you are chilling at. I usually say, when you are watching me and it's your first day, tell me which side of the country you are watching me from. Tell me which side of the country you are from. Tell me which side of the country you are, the world, you know, you are from. If you are a new person, hit me on the chat, tell me that I'm watching from this and this side, I'm this person, I'm called this, you know. So welcome everyone, and don't forget to subscribe to the channel. Come on, subscribe to the channel, my friend. Subscribe to the channel, and let's know where you are from. Let's know where you are chilling from. So we are talking about several issues. We are talking about several issues of the heart that are called cardiomyopathy. So these cardiomyopathies are a group of diseases that are affecting the heart, and we have started with dilated. So when I say dilated cardiomyopathy, I mean the heart ventricles are big. Look at this heart. I mean that these ventricles are bigger than expected. Yeah? Should I put this one here so that you can do it well? I mean that these ventricles are bigger than expected. They are big. They are bigger than expected. And when they are bigger than expected, what do you think happens? When they are bigger than expected, the pumping of blood becomes a problem. So the blood that goes on the left side, the blood that goes to your body, to your cells, becomes a problem. So that was dilated cardiomyopathy. Heart ventricles enlarged, and the giving of oxygen and something becomes a problem to the body. So we say that there are some people who have these things in their family which are genetic. Alcohol can bring dilated cardiomyopathy. We talked all those things that can bring drugs like cocaine, amphetamines. Those people that use these drugs, amphetamines, chemotherapy drugs. Remember we talked about chemotherapy drugs, viruses like viral myocarditis, Coxsackie B, adenovirus, parvovirus, influenza, that is flu. Even COVID, when people had COVID, they came with heart conditions, and those were cardiomyopathies. Alcohol, chemotherapy drugs like doxorubicin can give you the heart that is big. And we saw at the third trimester in pregnancy, some women have bigger hearts. It is called peripartum cardiomyopathy in pregnancy. Peripartum cardiomyopathy. So welcome my friends who are watching. Welcome to this channel, Benjamin the Wise Guy. Here we discuss about medical issues and medical problems. So if it is your first day here, welcome. Chat, have come late today. I usually come at 16:30 p.m. 16:30, that is Kenyan time, but because of things here and there, I've come late today. So my people, welcome to this channel. I thank you so much for being here. Thank you so much for being here. Burnout to be blessed. Burnout to be blessed is in the house. Thank you so much for tuning in and listening to this discussion. So if you are there watching it your first time, the chat is open. Please hit the like button and also tell me what you are thinking about, or if you have a question, let me know if you have a question. Now, endocrine disorders like hyperthyroidism, hypothyroidism, diabetes mellitus, and nutritional deficiencies. People that have thiamine, vitamin B1. We see vitamin B1. So you lack of taking vegetables can make you have make you have heart condition. You see, welcome my friends. Nafula, your question yesterday was Nafula. Hi Nafu, Laleti, how are you doing? And there's something I'm checking here. Nafula, welcome to the chat. Oh, you see, so you not taking enough vitamins, you can have a heart condition. So you should eat some greens when you get them. Don't just stay there. You see, thiamine deficiency can cause dilated cardiomyopathy because the heart cannot produce enough energy to pump effectively. This condition is called beriberi. And you know, beriberi disease is brought by people who like eating starch alone, especially maize, boiled maize. Shoshone beriberi. It's a life-threatening condition. Thiamine is essential vitamin, helps convert carbohydrate into energy. So when you have eaten some carbohydrates, it's the one which is responsible to convert it to energy, the main source for the cells. So you don't like taking these vitamins. You know, tomatoes and onions are vegetables. Yes, they are vegetables. As much as they are spicing food, they are vegetables. Uncle, how are you doing? Hey, everyone. Now we have more people watching. Please hit the like button and subscribe, please, as we watch. If you are new to the channel, tell us you are a new person to the channel. So you can avoid taking vitamins. You don't like vegetables. You don't like taking fruits. And you see, it is helping you. Michael N. Long time. How are you doing, Michael N? Good. I only want to take onions and tomatoes and eggs. And eggs. Wow. Beriberi disease. Man, no, don't get beriberi disease. Don't let your heart. You're not taking vitamin B1, thiamine. And then you want your heart to be big. You know, a bigger heart. I know that some people have always big up, my friend. Yeah, big up to you too, Michael N. We have burnout also. Burnout to be blessed. You do, and you know when she says burnout to be blessed, she says that you are working yourself out, helping other people so that you get the blessings. I think I'm right. I think I'm right upon that. Burnout to be blessed. I think I'm right upon that, right? Working yourself out to help other people so that you can be blessed. Hey, it's been ages. Yeah. Michael M is a busy guy. Autoimmune diseases like arthritis and sarcoidosis can make your heart. You know, sarcoidosis is a mutation of a protein that makes your muscles be complicated. So my friends, my people and my friends, you know, there are some things that we check on and we say that instead of eating living a sedentary lifestyle, it's good. Has someone brought some here we learn and we feel good. Nafula, please answer Michael N. Answer Michael. Answer Michael. Have someone brought some cows, or we are waiting for potential, as my friend Maro calls potential. Nafula, we are waiting for your answer about that question of Michael N. Nafula, bring it up. Yeah, guys, you make me feel, feeling so irate. How about you, Sunday? Do you feel it too? Nafula, answer that question. So we are talking about autoimmune diseases, things that can make you have a big heart. You know, when you go to a hospital and you hear that people have big hearts, it's called dilated cardiomyopathy. Hey, Michael Len, where is Nafula hiding? Nafula, stop hiding, man. No, stop hiding. Come on, tell us. Has someone brought cows yet? So things that can make you have this condition, your heart being big. Let's start with the first things first. Genetics. Maybe you are born with proteins that are affecting your muscles and your cardiac muscles are being bigger, like lamine, dystrophin, all those T-titin, you know. And then we have coronary artery diseases. Coronary, if you hear anywhere coron, just know it is the vessels that give your heart blood. Coronary. We have the right and left, and I usually show you guys. Let me show you coronary heart vessels. They are these ones. This is the right and this is the left. They come from the outer. They arise from the outer. Now, I like teasing Nafula. She's good friend. No worries. Hey, Nafula, come on. Don't hide. Come on, girl. Come on, girl. Talk to us. So genetics can make you have a big heart. Coronary artery disease can make you have a big heart because blockage and dilation. You know, when you block a pump, it dilates the surface area. Hypertension, high blood pressure, viral myocarditis. Virus can go and eat your heart muscles and they become weak and dilate. Alcohol, taking over years, it's toxic to your health. Alcohol is toxic to your health. Chemotherapy drugs, those guys that are on chemotherapy, those guys that are on chemo, doxorubicin, trastuzumab, you know this guy. I have not yet found favor in a man's eye. Hey, Nafula, are you a poet? Nafula, are you a poet? Like the poet, the Psalms of Solomon. Nafula is a poet. Just listen to this line. I have not yet found favor in a man's eye. Hey, sounds like the queen of the Solomon has written that poet. Like King Solomon wrote Psalms, and then now we are singing a song from the Empress of King Solomon, who is Nafula, it seems you know how to do some poetry. Yeah? Give me some lines, I get them straight. I feel yes. Nafula, Michael Len, you hear that? Now, let's continue. Chemotherapy drugs, and then when a woman is pregnant, during the last month of pregnancy, up to 5 months, the heart can be bigger because of a lot of work which is done and it dilates. You know, sometimes you find some women, when they are ready to give us a newborn, their blood pressures go high or sometimes go low because of this dilated cardiomyopathy. Endocrine disorders like hypothyroidism, diabetes, nutritional deficiencies like thiamine, we have talked about it. A very important subject when it comes to giving the cells energy, and you don't like taking vitamins. You take vitamins, man. Take vitamins. Autoimmune diseases like systemic lupus erythematosus, rheumatoid arthritis, and sarcoidosis. And sometimes we don't know. Sometimes it is not known. In many patients, no clear cause is identified. You go and search and research and you find this patient, they have no genetic connection these patients, these people, they have no connection with the kind of disease they are undergoing, no even genetic connection. So this person was born like that. We don't know. But the heart being big, dilating, you can be at risk. And at risk means you are closer to getting the dilation, like family history, genetics. Let's continue, my friends. We are learning. And please don't just learn. Interact, and if you have a question, let's get on and ask the question. Interact. Let's get on and find out what we are talking about. Now, smoking, viral infections, alcohol misuse. You like taking alcohol, you feel that guy Collins Buzz sings, I just wanna smoke, drink, pass out to some reggae, in kinky reggae. Please don't smoke and drink. Let me get that song. I just wanna smoke, drink, Collins Buzz, Collie. Why does the heart pump so hard during love making? Linus, bad people, please help me, my friends. Help me answer Navula, man. Navula is an energetic lady and likes making us laugh. Now, Navula is asking, why does the heart pump so hard during love making? You see, even when you are running, you are feeling the muscles, the heart pumping. Listen to this. Drinking a minute for now, maybe not the reading of the wine up and a dance. I wine to the, I don't know about you. All I wanna do every day is smoke, drink, I love my girl to smoke. Hey, I just wanna smoke, drink, I love my girl to some reggae. Please don't do that. Don't smoke and drink, Don't smoke and drink. Just eat food, exercise, feel good. Take wine, 1 cup, cool. You just don't want to smoke and drink and feel some, you don't want to do these things. These things are part. That you want to just, let me repeat that part. These are things that I don't like, but I love music. Listen. I love my girl to smoke, drink. I love my girl to smoke. No, don't smoke and drink. Don't. Just sing, I just wanna eat, drink, water. And I take my girl to some reggae. You listen to that. I'm tuning these things so that you can enjoy them. When you want not to get dilated cardiomyopathy, I just wanna eat healthy and drink and turn my girl to some reggae, say kinky reggae, to release some serotonin so that your mental health can be Now, when you are doing, you are making love, all the blood is pumped. If it's a man, it is pumped through the central unit stroking, and that is why your heart pump blood. All the hormones are elevated, especially testosterone and the prostate that is releasing excitement. So the pump should be pumping so hard. When you are doing a lot of work, that is it. When you are doing a lot of work, that is it. Now let's get going, friends. Let's get going. Nafula, I have answered you that obesity, certain chemotherapy drugs, and pregnancy can be a risk factor. You've seen the women at the 3rd trimester, they have a slightly bigger heart because the demands are rising. And obesity. Now, when you have obesity, it means your demands are so high. The work that you are doing, the brain and the body is high, so it may make you have dilated cardiomyopathy. Viral infections and smoking and viral infection, alcohol misuse, coronary artery disease and high blood pressure, family history, all those. And what are the early signs and symptoms? Always you are tired. You don't like tolerance in exercise. You do some exercise and you feel so tired. You feel so tired when you do some exercise. Shortness of breath. You just climb some stairs and you are so tired, my friend. You are so tired. Now, progressive disease. When it is the left side of your heart affected, you will feel breathlessness, autopnea, paroxysmal nocturnia. You are just tired. All these things are explaining a tired person. Pulmonary edema. If you check an X-ray, you find that the heart and the pulmonary is affected. Right side heart failure. If it is the right side affected, you will swell the legs. These things we did them yesterday, and you see today we want to do management. How can you manage a person with a dilated cardiomyopathy? You have already taken several starch. You have always used alcohol. You have always. Pulmonary edema means it's getting swollen. No, pulmonary edema means in which way can I explain this in a layman language? Let me think. Edema means swelling. Pulmonary means the lungs and the pulmonary artery that comes from your heart to the lungs. That is the pulmonary. So when I'm talking about pulmonary edema, I'm saying fluid that is excess and swelling from the heart, that pulmonary artery to the lungs. You see? You see? I think I'm explaining it at least. Is a condition which fluids builds up in the air sacs in the lungs. You get some fluids and they make the lungs swell. Inflammation occurs. So if fluids get to your, let me explain by drawing. I love drawing Nafula. Nafula, I like your questions. Your questions jam up everywhere. Nafula is a lively girl. Lovely and lively girl are both the same, right? Lovely girl and lively girl. Lovely girl and lovely girl. Now, let's draw. Now, this is your heart. I'm drawing a heart. I want to explain pulmonary. Pulmonary is another way of saying that the lungs. Is another way of saying the lungs, and so blood has come in. I'm drawing pulmonary pathway. I'm drawing pulmonary, but this pen of mine is getting fakey. I'm drawing pulmonary pathway. So if you are here and you have a question, just ask the question, so that we can know how to help you. I'm drawing the tree. So look at this. So this is the heart. This is the pulmonary artery. It is coming to the lungs. So the whole tree from here, the pulmonary valve going to the lungs. These are the lungs. It is called pulmonary tract. Is this one. So if you have you see, these are the alveolus that exchange oxygen and CO2. So if you have fluids that are in these air spaces, it is called pulmonary edema, because the fluid is making is making these lungs to swell. So that is called pulmonary edema. Pulmonary edema. So the track, let me show you from the heart. This heart that is here, you see this one. This one is called the pulmonary artery. It is called the pulmonary artery. So the pulmonary artery is the one that has come from the heart. You see this? And it has gone to the lungs to get oxygen. You get? So you get that one. There is another one that is called the pulmonary, that brings pulmonary vein. So Nafula, I think you have understood, like pulmonary veins, the lungs, and the vessels that give the lungs blood. The vessels like artery and vein. So artery, these are two different things. Pulmonary artery has no oxygen. Pulmonary vein has oxygen. The difference between. So that is, it means they are swollen. The lungs are swollen. Anytime you hear pulmonary edema, it means the lungs are swollen. So common causes of thiamine deficiency, you have talked about it. Alcohol is first cause. Alcohol is first cause. Severe nutrition, vomiting, long-term dialysis, HIV/AIDS, and cancers are causes of thiamine deficiency. And when you have thiamine deficiency, what do you have? We will have problems like dilated cardiomyopathy, your heart being bigger, and you see, you will have symptoms like every time you are tired, palpitations, difficulty in exercising, peripheral neuropathy, muscles weakness, loss of reflexes, confusion, memory impairment, even memory. In severe deficiency, you'll have them. So those are things that we look at and we say, this person has a problem with this and that, pulmonary edema and deficiency. Now, cardiomyopathies. Cardiomyopathies, we are talking about how to manage them. Oh no, no problem. So don't take alcohol. Nafula, if you are taking alcohol and smoking, please don't take alcohol. Just stop taking alcohol. I don't like alcohol personally. Now, doctor, I am watching you and Marwa. Oh, nice. My friend is premiering now. Okay, that is nice. He's enjoying at the cost. Nice. That is very nice. So those are things that we look at and we say, okay, so there is this problem that is coming up nowadays. I don't take alcohol, but a food. Which food? Carbohydrates, chipo, pizza, those things, chicken, you know. You take those ones. Importance of management of some managing this cardiomyopathy. It is very important. Someone has texted me something here. It's very funny. Let me reply. So you see, let's learn how to manage. If you have found out that your heart is big, and then you are told that you have something that is called cardiomyopathy, dilated, your heart is big, it's dilated. So when you are told that your heart is big, what do? You are a great artist. Yes, which artist better to be blessed? Singing or drawing? Sometimes I sing, sometimes I draw. So dilated cardiomyopathy management. When you are told at the hospital that maybe Bano to be blessed is saying drawing. So that is an illustration of your heart. My office is full of illustrations. Yes, welcome. If you are new to the channel, please don't fail to hit the like button and subscribe. Sampanda Ahmed designer. Hello brother, I'm from Daba Baya. Like that. Thanks for your like. Thanks for your like. And we are talking about people that have big hearts, how it came by. So we have done how it is dilated. This is a condition of the heart. So let's do about management of dilated cardiomyopathy. Management. Listen, once your heart muscles have dilated, they are big. Once these heart muscles are big, sometimes if you don't treat it so early, it will bring a problem. You are drowning in sugar. You are drawing. Oh, I know how to draw. Wow. Even Bernard to be blessed has told me I am an artist. Nice. So once these heart muscles have dilated, they are big. But coming back to the normal condition becomes a problem. So this aim, God bless you, brother. Thanks, Sampara Ahmed, the designer. Subscribe and share this, Sampara. Share this channel to your friends. Let them subscribe to me. Let's be brothers keeper. We want to grow and grow. Sometimes when you grow, you remember the people that made you grow. Yeah? You remember the people that made you grow. Now, how can you manage? First of all, we want to understand that you have to have the aim. Nafula, seemingly doctors make good artists everywhere. Yes, because you need to understand how the body does work and how their anatomy are, how the anatomy is. So the aim of you sometimes is not healing. Once you have gone to dilation, the aim that you have for the aim that you have is to improve the symptoms, slow or stop disease progression, improve heart pumping function. You improve the heart pumping function, prevent complications such as arrhythmias, stroke, and sudden cardiac death. Because once this heart has dilated, it's big. Coming back is a problem. And when you're pumping, you are pumping blood, like when you're pumping blood to the body, some blood comes. You know, when the heart stretches, even the valves leave some space. So some blood comes back. You see, this one, some blood comes back. So let's talk about reduced hospitals admissions. Our aim here is for reduced hospital admission, increase survival, improve quality of life, and prevent complications such as arrhythmias. I said arrhythmias are your heart beating so slow, your heart beating so fast, and your heart beating without direction. Arrhythmias like bradycardia, tachycardia, fibrillations. You know, tachycardia is fast, bradycardia is slow, your heart beating slow. But there is another one that is very fast that we don't know how to say. We call it fibrillation. So, and I explained, like, this is your heart. This is your heart, and it's beating like poo, 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 poo. Very slow. Normal, poo, 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 poo. Faster, poo, 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 poo. Fibrillations. Hey. Even that one, blood cannot flow. Beating without direction. Yes, beating without without directions. You know, when you talk like that, some people understand it so well. When you say your heart is beating without direction, because people want to understand the really layman understanding. Now, we have talked about that one. We are helping people to improve symptoms, slow or stop disease progression, improve heart pumping function, improve quality of life, and increase survival. Hi, Mr. Benjamin. Hi, my friend Fiona. Fiona, in Uganda, do people have heart diseases? Most of the people, I've never met anyone from Uganda who has heart disease, or it means you are satisfied with life. Life in Uganda is good, no stress. We eat well, we eat vitamins, thiamine deficiency is no problem. You see, Now we are managing dilated. You are a bigger heart. When I say dilated heart disease, just know I'm saying the heart is big. I'm saying the heart is big. Now, there are very many symptoms that are upcoming when it comes to these things, this condition. So, one you need to do is to identify and treat underlying cause. Identify and treat the underlying cause. And how do you identify and treat the underlying cause? We do also have people with heart diseases in Uganda. Okay. Hi, Coffee Cakes. How is everything, Coffee Cakes? Hope you are doing good, Coffee Cakes. Today we are just managing dilated heart conditions. Coffee Cakes. I hope the headaches subsided. Hope you don't have headaches right now, and you are good. You know, sometimes you go so down until I start asking myself, what's going on with the Coffee Cakes? What's going on with the Coffee Cakes? But I know you are okay now. Headaches have gone away. Now, I'm coming home. When I'm giving some tips, I like singing. So Benjamin the Wise Guy channel is home, where we talk and listen and smile. So we sing when you come here. We sing, I'm coming home, say tell the world I'm coming home. Now let's continue. You have to treat hypertension. If your heart has dilated, it's bigger than expected because of those things that I've named. What you need to do is you need to treat and manage hypertension. Control blood pressure with appropriate medication. Reduce salt intake, because salt intake always salt retains what? Fluids inside you. Encourage weight loss if overweight. Weight loss. This is something that is really giving people head over time. Weight losing. You make an uncle with the other arm on a different device as I'm at Maro at the same time. Oh, I heard that you must now on 2 live streams as such as because lose watch hours. Yes, if you stream with the same device to 2 different people, you are making that person to lose hours. What test tells that it is enlarged? Oh, you do echo. You do something that is echo. It's called echocardiogram. You will see prolonged QT waves, and also you can do a chest X-ray. A chest X-ray will show you something like this. Coffee Cakes. I've seen people that have told you have a boot-like heart. You have a boot-shaped heart. Let me draw the lungs here. The trachea, then the lungs. You have had people that have said they have a boot-shaped heart. What do I do when weight is not going nowhere now? Have you tried losing and it's not going anywhere? Nafula, have you tried? Or you eat a lot and you don't practice? I usually say, as you eat a lot, you need to hit the gym a lot. And if you want to cut weight, don't do a lot of carbohydrates. Do proteins and stop eating carbohydrates. So if you do a chest X-ray, your heart will look like this, like a boot. We call it boot-shaped heart. Yes, I have done like a sonogram. Yes, it's like a sonogram. EKG, electrocardiogram, those things. EKG, you can do not endoscopy. You can do chest X-ray. And is there a drug to help speed up weight loss? Yes, there are drugs. But why should you use drugs when? Why should you use drugs when you can do normal therapy to stop weight from progression? Stop eating carbohydrates, eat proteins, do exercise. And although your protein eating only will make you be dizzy, because now before you get energy from proteins, it takes long. That's why there are some drugs that you can take to reduce cholesterol, but you need to talk to a doctor first for some physical examination from these drugs, so that you cannot get complications. You get, so that you cannot get complications. So coffee cakes, you can do a chest x-ray, you can do the ECG. If you do the EKG, you'll see prolonged QT waves. You know this heart is big and it's not contracting as normal. So coronary artery diseases, you identify the treatment for this problem. You have said is to increase survival, reduce hospital admission, improve quality of life, and treatment sometimes and returning the muscles to normal may not be off. You may not achieve unless it is acute, like in pregnancy, something that has happened acutely. That one you can try, but in this instance it is complicated. Now let's do alcohol induced dilated cardiomyopathy. So what do? The first thing you do is to stop taking alcohol completely. Because if you continue taking alcohol with this problem, it will make you have fatality. They had me on echo and a stress test before surgery. Yes, to check if your heart can withstand. The surgery. Yes. Viral myocarditis, supportive heart treatment, give antivirals and treat specific infection. Even avoid strenuous exercise during recovery. Nutritional deficiency, like correct deficiency as vitamin B1, selenium and creatinine in selective carnitine in selected patients. So you can give thiamine, give supplements for thiamine, so that the heart muscles can gain some energy to work and not retreat. If someone is having hyperthyroidism and hypothyroidism, give the hormone, supplement the hormone, because you cannot treat hyperthyroidism. What you can do is to supplement or do a surgery. You see, diabetes mellitus, if you are diabetic and it's the one which is giving you this problem, because sometimes diabetes can make your heart muscles to stretch up. You see, so these are things that you should try and correct. If a person is going for chemotherapy, make sure that this person is getting discuss with the team that it is called the oncology team about modifying or stopping the drug first, stopping the drugs before it continues. Start guiding direct heart failure therapy. Start the guidance. But now, if it is a woman who is pregnant, what do? A woman who is pregnant and is having peripartum cardiomyopathy. Standard heart failure treatment with medication of choice should be given during pregnancy and breastfeeding. Care coordinating by cardiology obstetrics. You should check the obst, the people that take care of the baby. You see, you should check on your lifestyle. Like now, you are just born with a good body, and then lifestyle has made you to be obese. What do? Stop eating processed food, fast foods. Somebody really subscribed. Welcome, somebody really. Thanks, somebody really. What is the motivation between somebody really? What is the motivation between on your name? Thanks for subscription, and interact with the people that you are seeing in the chat. Right? They are good people. Interact with them, chat with them. Somebody really. Salt and Snacks is my friend, great supporter. Oh, okay, nice. Good one. I support. Now you are at a good home. Somebody really, you are at home now. Here, you will get more supporters and they will support you too. there are some things when it comes to lifestyle. Let me talk about it, and it about the heart. And about the heart, I want to explain it to you. 4 important things about the health of the heart, and you should control them. Processed foods, fast foods, like French fries and fries, salted snacks, and excess table salt. If you want the health of your heart to be at par, avoid or take minimal fast foods. Avoid or take minimal processed foods. Avoid or take minimal salted snacks. And the last one, take minimal table salt. This man is very intelligent and sophisticated. Somebody really now. yes. Somebody really. You're welcome to the chat. Welcome to the family. There are some people who go to hospital and well, gone. Oh, you want to write that down? Let me repeat for coffee cakes. Coffee cakes. Somebody really, the radicals got me. Okay, processed foods, fast foods, salted snacks, and minimal salt. That is the way to go for your heart not to have dilated cardiomyopathy. Fluid restrictions. Consider restricting fluids, not taking a lot of fluids. You know, now here you have dilated cardiomyopathy. If you take a lot of fluids, your heart will have a problem when it is pumping blood because you are giving your body a lot of fluids. So 1.5 to 2 liters per day, and that means not water. Fluids, everything that you are taking like tea, like juices, like water that is getting on. Take 1.5 to 2 liters, like a person who is on dialysis, you get. Because people that are on dialysis, they are always restricted to fluids. Now, weight monitoring is very important. When you're finding that you are so comfortable and you are undergoing the weight that is so large, be careful. Be careful. Exercise. I'm still talking about exercise. Regular and moderate exercise can improve functional capacity in stable patients. Avoid heavyweight lifting so that you can have big muscles. No everywhere. Moderator for over 2,000 channel. Oh, nice one. Somebody really is I daily remind to hydrate, drink water. Yes. Oh, Nafula, you are 94. And your height, check because you can be 94 with a very big height. With a tall, you are tall. So it is called the BMI. Weight goes with the BMI. If your height is tall and you are 94, you calculate with your height. If you see your BMI is good, you are good. But if you are shorter and you have 94, there is a problem. Avoid smoking. And that's why I've said, listen, I've said this. I've said this. That guy was saying, I just want to smoke, drink, I love my girl to some reggae, say kinky reggae. You have to say this now. From today you are saying, I just want to drink, I just want to eat greens, I love my girl to some reggae. You know, I just want to eat greens, I'd love my girl to some reggae. And then the second line you say, I just want to eat, drink. You know, don't say I just want to. This song, you know, guys, don't smoke and drink. Don't say this again. And you say kinky reggae and you are there smoking and drinking and think you are doing the best thing. Hey, You are getting closer to dilated cardiomyopathy. Dilated cardiomyopathy will come and I hit you. Let me repeat it. Don't do this. Don't do. Don't do that. Don't smoke and drink and take your girl to some reggae. Eat greens. Say, I just wanna eat greens. I want my girl to some reggae. Then you feel nice and say kinky reggae. Yeah, you see, nice one. We want to feel nice. Now, avoid alcohol. Alcohol reduces your vitamin B in your body. Thiamine. It reduces thiamine to your body. So you don't ever drink again. If you like alcohol, take that alcohol away from your vicinity. Say, I just wanna take greens, I take my girl to some reggae, Nafula, do you drink? No, you've said you don't drink. Eat greens and drink water. Yes, I just wanna eat greens, I take my girl to some reggae. Go and feel nice and come back and say, I just wanna eat drinks. Vaccination when it comes to viral problems. Don't do what? Don't avoid vaccinations like influenzas. In Kenya, in my country here, we vaccinate people with influenzas so that you cannot get what? You cannot get the infection of the influenza. Now, drugs you can use are like ACE inhibitors and ACE inhibitors are like lisinopril, angiotensin converting enzyme inhibitors. I bet Coffee is plotting on a new song right now. Coffee. Now, angiotensin, that one helps in when the kidney has released renin, so it inhibits that enzyme so that it can not convert angiotensinogen 1 to 2 to make your blood vessels to constrict, like enalapril, lisinopril, and ramipril. So if you are on enalapril, just know it is helping the kidney and the enzyme. They reduce vasodilation, reduced overload, and ventricular remodeling, and improves survival. Improves symptoms, reduces hospitalizations, and increase life expectancy. Side effects of these drugs are like coughing and raised potassium. Those are for hypertension. You must take care of your body by checking Lil Rock. Hey, okay, the coffee cakes likes rock music, right? Coffee cakes like rock music. Mineralocorticoids, agonistics like spironolactone. I like those ones. Potassium and kidney function. Those ones. Now, those are things you should do. You should check on the condition you have, and if you are diabetic, you should got my heart growing in a bad way, so to alcohol. I say no way. Greens are better than anyway. Yes, alcohol, no. There are some, when you are too bad, we give you aspirin, anticoagulants like clopidogrel, aspirin. Those are anticoagulants so that your blood can pump well. Later that's there. How the doctor sings, at least no love. Yeah. So if it is worse and it cannot be helped, because drugs cannot help anymore, what we usually do is we implant a device to your heart, like somewhere here, where the tequila a shot a day is good. No, somebody really, I don't like alcohol. I don't like talking about alcohol. Alcohol will give you fatty liver. Alcohol will give you problems. No. So let's talk about something that is called device therapy, like implantable cardiomyopathy fibrillator. Prevents sudden cardiac arrest by detecting and treating life-threatening ventricular arrhythmias. So there is an implantable cardioverter ICD. It's called ICD. The implant on your chest. So wherever you are going, it is detecting how your heart is pumping. It is called implantable cardioverter defibrillator. It stops the your heart beating so fast that cannot even pump. So it stops that and brings back the heart pumping normal. You see, so left ventricular ejaculation of less than, let me come, just a minute, my guys. Don't move your chair. I'll be here just in a minute with something. Yes, I'm back. I was here. Okay, now, okay. Let's continue. So, when you are having fibrillations, we give you that device. Fibrillations is your heart is pumping so faster. The heart is pumping so faster. Even like your heart is pumping like. So that one cannot pump blood. What pumps blood? You see, so when the ventricles are pumping blood with less than ventricular ejection, the blood that is coming out of the blood is less than 35% because it's pumping so fast. Does alcohol affect the lungs as well? How the alcohol affects the lungs? Yes, it can affect because when you're taking lungs, most of your vessels constrict. Yes, most of your vessels constrict, and when they constrict, the lungs does not function in a good way because the oxygen levels and the air that is coming in your lungs is small, less. You see, so it affects. Alcohol affects many things in your body. Alcohol affects so many things. Pneumonia, weakness, aspirated pneumonia, those things it cannot do direct, but it affects indirectly and slowly depreciating the walls of your lungs. So when I say don't love alcohol and smoking cigarettes, please don't take alcohol. So those devices that are called ICD, implantable cardiovascular defibrillator, they help to stop the pumping, the heart vessels pumping by inducing some electrical. They kind of like balance the electricity that is going through your lungs and body. So when they are kind of like helping, it stops to beat in a weird way. And when it is beating so slowly, what happens? It helps again to reinduce the normal track. You see, it helps to reinduce the normal track of the heart beating. So, what will I? Minute, my guys. Okay. So if you have seen why you have dilated cardiomyopathy, what we can do is to help you not to get to severe condition. And wonder due to a breathalyzer. Yes, breathalyzer only shows the amount of alcohol you have taken for a night, for a day. That is what it's showing. In the US, I think, even in Kenya nowadays, if you are found driving and drinking a lot, they give you a breathalyzer to see the amount of alcohol you have taken. So that is it. So we are continuing how to manage this thing, and mostly what you are seeing through the lungs. So yes, through the lungs, because no, not through the lungs, through the esophagus. You have the pipe that goes to the lungs, and you have the pipes that goes through them. So when you are doing, you are getting air from the lungs and also from the stomach. So they mix, and then the breathalyzer gives the correct amount you have taken. Because alcohol also, the alcohol that is in your blood can be felt when it is coming out of your, because it turns to some gases like methane, you see. So let's continue about it. So those devices we put on your heart, they are monitoring if the heart is beating so slow or it's beating so fast. Cardiac resynchronization therapy, that one is very important. Cardiac resynchronization therapy is very important. CRT, it coordinates how the heart contracts. And you've seen some people using Dorothy High, the jumpers. They put shock, then the heart comes back. And you know, when your heart is, the jumpers are put, the shocks that you see, that time your heart is really pumping so fast, like that. So when you shock them, the electrical system starts to be induced normally. And that's why you have had, even in ICUs, the echocardiogram, the ECG that monitoring machine, you will see it beeping like t. It is taking the pace of the electricity that is induced from this right atrium, the sinoatrial node. So when it hits T, you will hear that machine doing T. Coffee, you are a loyal subscriber to Dr. Big up. Yes, Coffee X is my friend. Good friend like you, Dorothy. And there is this lady from Jamaica called Marjay B. also. Very nice people. And one day I'm going to visit them. This year I cannot travel. I still have, I thought they only shock you if it stopped. Wow. No, you are not shocked when it stops. You can be shocked when it stops and it wants to be fibrillated so that you start pumping normal. But when your heart is beating so fast, like poo, 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 it gets to another stage that is called fibrillations, where it is doing, you see, that one is another one. So when it is getting to fibrillations, you cannot know it's fibrillating because it's not pumping, it is vibrating. So if you shock it, it stops. Most of the people that are giving the shocks, it is to defibrillate. If you check mostly on the echocardiogram, those, you see, in the echo, the sign is like this. If you check those things that go like this, it goes like this. But when it is defibrillating, that person has died, the sign comes like this. They are called fibrillations. So that is the main, when you are shocked. So synchronizing is that when you defibrillate and then it comes back. Where is that picture? Look at this. Look at this picture of ours here. You see, this is the left side, and it has sinoatrial node. So this is the node that sends the electrical system, and it gives an electric system that it can give like slow or high. So when it is slow, it is giving like, so this one can go to faster like pa 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 until it goes to, you get it. So those ones are the ones that are given defibrillations. You see, those ones are the ones that are given defibrillations. Thank you, Dorothy. Welcome, as he has many. Yes, thank you for being my supporters, man. But you see, you as you support me, at least you help someone with knowledge. When you get something new and we discuss something here new, please, when it is time for emergency, use the knowledge to have to advise someone. Tell someone, I heard this from Dr. Ben, and you can be helped in this and this way, do this and that. And you see, but if you have anything that you think we can discuss here and help someone, please don't fail to tell us. So those are things that we give the shocks. Advanced heart failure, that one we give dopamine, dobutamine. Those are drugs, and milirone. There are drugs that we give when the heart is really failing. Even pumping becomes a problem. So they have to help the heart continue getting the electrical circle. So mechanical circulation like intra-aortic balloon pump. You have seen some people giving the plastic stents if their hearts are failed. Bridge to transplantation, destination therapy in selected patients. Sometimes when the heart fails in dilated cardiomyopathy, the heart has really failed. We call it end-stage heart failure. We go for heart transplant. Persistent appear symptoms that you cannot control. This person is having a major symptom that you cannot control. You can just go for a transplant, because now heart becoming bigger and it's not serving the purpose. You get a transplant. So you follow up daily by fluid intake, measure blood pressure after what we have done. If you have been given drugs, make sure you are visiting your doctor every time you have an appointment. Don't jump appointments. If you have dilated cardiomyopathy, don't jump appointment. Adjust medication doses. That is the work of a doctor. Don't adjust by yourself. Be on call with your doctor every time. You see, sometimes we even give oxygen. When you see the oxygens are down, vasodilators. You have seen some people that are walking around with oxygen tanks. These are the people that it's not only the lungs, even dilated cardiomyopathy. Sometimes they are given the oxygen and told you can oxygenate yourself when necessary. You see? And then something like furosemide, you are given to release the load, because furosemide is a diuretic. When you take it, excess fluids come out of your body. Non-invasive ventilation for pulmonary edema and indicated ventilation. Those are oxygen devices. So for cardiogenic shock, cardiogenic shock is done in ICU, and doctors give some things like ionotropes, and mechanical circulation is done, and we go on. So that is all about dilated cardiomyopathy. That is all about it. We want to learn about, next time we will talk about something that is called hypertrophic cardiomyopathy. Hypertrophic cardiomyopathy is thickening of your heart muscles. Now they are not so big, thickened. They cannot load and thickening. So anyone Anyone who is here and has a question before I log off? Anyone who is here and has a question? Okay. Before I log off, before I go off, yes, I think there is no question. Let's meet tomorrow to discuss. Let's meet tomorrow to discuss what? We meet tomorrow to discuss something that is called hypertrophic. Have a nice time. Be blessed. It has been 1 hour 10 minutes of good talks. Bye bye. See you.